options available for 20-something females with bags under eyes. I'm 27 years old, female, with bags under my eyes that don't go away no matter what I do. I don't want something temporary like fillers. So, what are the available options and which is best in terms of leaving scars or not, downtime, and if it should be redone after a while? I don't have saggy skin.
Thank you for your question. You're 27 years old and you've submitted photos that clearly demonstrate puffiness under your eyes. And you're asking the typical questions about a procedure that is definitive, that is with minimal downtime, and anticipating, hopefully avoiding sagging skin afterwards in the future. Well, as a cosmetic oculofacial plastic surgeon practicing for about 20 years in Manhattan and in Long Island, this is probably the most common thing we deal with. And so I think we can help you by understanding first what is the situation and what's the anatomy and the basis for your issue. A lot of times people who have puffiness under their eyes often will think that it's due to lack of sleep, due to diet, and certainly those factors can have an impact. But when you have puffiness under your eyes that's always there, then it is typical of something we call lower eyelid fat prolapse. Now, what is lower eyelid fat prolapse? Well, this is a situation where typically it's genetics and the fat that's normally around your eyes pushes forward and creates a bulge. And we refer to it as herniated fat. So, very often people will first try the approach of using topical creams, and lately it has become an approach of doing fillers to try to camouflage the puffiness under the eyes. Now, although fillers such as hyaluronic acid can help camouflage lower eyelid fat prolapse, in my experience it's usually minimal lower eyelid fat prolapse that is amenable to this type of treatment. In my practice, for someone who is young like yourself, our typical procedure that we recommend is called lower eyelid transconjunctival blepharoplasty. Now, this is a procedure that is a surgical procedure, but it does qualify as a relatively minimally invasive surgery where we're doing the procedure from the inside of the eyelid, so there's no external incision or scar, and we sculpt and reposition the fat so that you have a nice natural contour as if you never had fat pockets pushing forward. And it works out very, very nicely. In terms of quick recovery, I can tell you that a large percentage of our patients have barely any swelling or bruising of any significance in about a week. Sometimes you can get a little bit of a bruise under the eyes in a week. It is usually easy to hide with a little makeup. By 2 weeks, most of the bruising or a little bit of bruising is gone. And it works out very, very well. I would often argue that a lot of people who are trying to avoid surgery and subject themselves to multiple types of fillers and injections actually get more traumatized by the injections than they do when we do this type of very, let's say, delicate and very precise approach to reducing the fat pockets and more definitively. Something I can tell by your photos is about your skin quality. And very often when we do this procedure, we will combine doing this fat prolapse surgery or transconjunctival blepharoplasty with something called platelet-rich plasma injection, which is derived from your own blood. We have found that when people have very crepey skin or very kind of a hollowing in the tear trough area, we will inject this platelet-rich plasma as a way to help stimulate the collagen and the vascularity of the skin. This is something that's very leading edge, and we have been very successful with it. Borrowing a lot of the technology that was achieved from orthopedic surgery and in oral surgery for wound management. As far as the question of sagging skin, I can tell you that I've done transconjunctival blepharoplasty in people in their 70s. And when there is no excess skin, the skin will retract inward. And that has to do with the muscle and the skin anatomy around the eyes, which the muscle called the orbicularis muscle will actually act as a belt and push inward. As you get older, and depending on your genetics and your environmental and medical stresses in your life, those all have a factor in how your eyelids age. Think of any American president on day one, and then 4 years later, you very much see the stress of their job in their eyes. So, taking care of yourself from a foundational perspective, good diet, exercise, sleep, is also a factor. But as far as the fat pockets are concerned, for most people it is really a procedure that has incredible longevity. In practicing over 20 years, I've seen my patients as we've all gotten older, and they'll come back and see me and tell me how good they look even 10 years, 15 years later. And maybe we'll be doing other things, but we're not dealing anything related to the fat under the eyes. Sometimes a little bit of fat can move forward later in life, and that can be addressed at that time. So my recommendation for that definitive procedure you're looking for is a transconjunctival blepharoplasty. I advise that you meet with a qualified, experienced cosmetic surgeon who performs a lot of eyelid surgery, and find the one that you resonate with, and move forward with the procedure. So I hope that was helpful, and thank you for your question.